Community Club. We're back with another Her Story episode with Urban Baby Beginnings, and we're here for Black Maternal Health Week. Black Maternal Health Week is April 11th through the 17th, and we're excited to shed light on the topic tonight. We will also be joined with Family Forward this evening to dive deeper about Black Maternal Health Week. We are joined again with founder and executive director of Urban Baby Beginnings, Stephanie Spencer.
Hello, how's everyone doing? So happy to be here today.
So glad to have you here. Urban Baby Beginnings is the leading nonprofit providing community service support services specifically for pregnant and parenting families in Virginia. Next, we're so excited to have her back. She is Jamia Crockett. She is the CEO of Families Forward. How you doing, Mia?
Hello, hello, everyone. So glad to be here. So excited to talk about Black Maternal Health Week and all the things about Black moms and Black babies. So let's get into it.
Let's get to it. Well, Families Forward is a nonprofit organization, Virginia's organization dedicated to disrupting the cycles of child abuse, neglect, and poverty. Supported both public and by private funding as well. Families Forward provides statewide leadership for and unifies support for a multitude of Virginia programs through evidence based and multi generational prevention strategies. All right, let's start the dialogue tonight. We are highlighting Black Maternal Mental Health Week. We will discuss maternal mortality rate and contributors, mental health, community support, and home visiting, and resources and service recommendations. So we're going to load this all up in 15 minutes. Let's go. All right, Stephanie, Black Maternal Health Week is here, April 11th through the 17th. What exactly is Black maternal health?
Yeah, it's really an effort to recognize the challenges and disparities that women of color and Black women more specifically experience during childbirth and the postpartum period. And it's also an effort to ensure that we're uplifting community voices, Black community voices, in the role that we all play in terms of having better and healthier outcomes. And so I'm not sure when this week was actually implemented, across the United States. But I can say that even more recently in Virginia, we have elevated this effort, and we now have a Black Maternal Health Week in Virginia.
Wow, this is good stuff. And I'm sure you're instrumental in all of that that's going on, Stephanie. Back to you again. What are some key statistics highlighting disparities in Black maternal health?
Sure. Depending on state, Black maternal health, the state, Black maternal health looks a little bit different in terms of outcomes and experiences. But what we do know that in the state of Virginia, that Black women are 2 to 3 times more likely to have to either have mortality as it relates to the postpartum period or during pregnancy or during delivery. And also that our infants are more than likely to pass away as well due to complications or preterm birth. And so elevating this is extremely important to communities because we want to help to empower people to ensure that they're getting the support and resources. One other thing that's just very interesting to note is that we also know that Black women are more apt to have mental health related issues as well. And that in comparison to their counterparts, it's also much higher.
Thank you, Stephanie, for that. And for folks who are just joining us, we have Urban Baby Beginnings on, and we have Families Forward, and we're talking about Black maternal health. Now, Mia, can you touch on this regarding the maternal mortality rates? Can you discuss the contributors to mortality?
And that's such a great question. And thank you so much for allowing us to have this really important conversation. When we think about the contributors to mortality, a lot of Black women, we are coming in with the stresses of the world. We're coming into pregnancy and or entering in healthcare systems with already baseline health issues like diabetes. Maybe we're slightly overweight. Maybe we've got hypertension. Maybe we've got other health issues that are like baseline health issues. And then you add being pregnant, which is its own health moment. And then all of a sudden you've got a perfect storm for something to go wrong. And when we come into these trusted healthcare systems, we are saying to these healthcare systems, I am putting my life and the life of my baby in your hands. We're trusting systems to take care of us once we cross the door. And what we're learning after looking at data and data and data, we're seeing that that's not happening. Black women and Black pregnant persons are entering into the healthcare systems already burdened with all the things that we have. And we're trying to deal with this medical moment of trying to deliver a healthy baby and wanting to survive delivering a healthy baby. And what we're hearing, what we're seeing from the data is that that's just not happening. And so being able to elevate this is really important because we want women to feel safe in all the systems that we touch. And so what we're seeing is healthcare has not been the safest place or space for us to really thrive and do what naturally comes to us, which is, birthing a happy, healthy, happy baby and starting that family piece. We're learning that's just not happening.
Mia, so in other words, if you're not healthy at this point, we need to start the process of getting healthy for the baby.
Absolutely. That's that prenatal moment. That's that. As soon as you just find out that you're pregnant, are you doing your prenatal vitamins? Are you getting into a healthcare provider so that you can start that journey? It's 9 months to grow a baby, right? And so every minute counts in that 9-month moment, that gestational period. Those 9 months are important, but it's never too late. If you find out you're 3 months pregnant and you're like, eating hot dogs and fries, well, you can just add some vitamins to that, start drinking water, maybe sprinkling some vegetables.
Mia, hot dogs and fries now.
That was me. I was Taco Bell, hot dogs, fries, and then I was like, wait a minute,
Really?
I'm pregnant. And then I had to get on my prenatal vitamins. I had to, go to my primary care provider and get connected to a healthcare system to then start figuring out the best way I was going to be able to have a successful, healthy pregnancy. I've got multiple sclerosis, so I came into my pregnancy with a different health baseline off the top. And so I really had to be really mindful about all the other things I have to manage with my health and the health of my baby at that time. So, the earlier the better, but whenever you start, it's never too late. So for some women who are like, oh my God, I'm 6 months and
let's do
you can
it.
always start. You can always start from today to ensure that you can still have better birth outcomes.
Thank you so much for sharing that, Mia. Now back to you, Stephanie. Can you expand on some common maternal health complications experienced by Black women?
Yeah, for sure. Absolutely. One of the things is related to cardiac issues. So we tend to see, Mia pointed it out that, we have these pre-existing conditions, things that are happening during our prior to pregnancy, and sometimes they're not necessarily addressed or not addressed in a way that, ensures that we're healthy when we do become pregnant. And so those things carry on into our pregnancies. And we are seeing that cardiac related issues is one of the things that is a predisposing factor to having complication in the postpartum period. There's some things that happen during pregnancy, like preeclampsia and also gestational diabetes, but also I know that many people already know about diabetes in general. So you might be fighting that and trying to be healthy in that instance as well, and not really having that under control. So when you get into pregnancy, it can be something quite different. Similarly to hypertension. But there's something to be said as well in relation to other factors that have nothing to do with health and well-being, like mental health, cardiac related issues, and all of that, but also the effects of more environmental effects. So looking at homicide, suicide. We know mental health issues are contributing factors to that. Intimate partner violence. These are also things that are affecting and plaguing our Black communities as well. And we must talk about that and address it as well.
Yeah. How do socioeconomic factors contribute to Black maternal health disparities, Mia?
Yeah, that's such a good question because a lot of times, you hear these horrible stories, and then you're like, oh, the parents were at 200% federal poverty level, or they were those families that were living in, projects or subsidized housing. So you think bad outcomes equals, okay, maybe you don't have the resources and the funds. True. And then we're also seeing that women who identify in the mid to upper class, even upper class echelon of socioeconomic status and resources are also having bad outcomes. So it's not money. People want to say, oh, it's poor families that are having these bad outcomes. No, it's all families who enter the system where there's implicit bias, where there are folks not listening to the pregnant person or the mother to say, hey, there's something going on with my body. I need to be checked out right now. And that's regardless of social economic status. And so that was one of those surprising yet also very, very concerning issues, because it's like, oh, if it's just money, we'll give people access to health insurance, give people money to take, for their prenatal visits. For Black and brown moms, that's not the case. I could be a millionaire, as we've seen, like some are like the Venus and Serena Williams stories, and some of these famous folks who have money and access to all the care, still having bad outcomes. So it's not really about money. Money is a contributing factor, but it's not the only factor. And so a lot of times when we're having these conversations, we want to show and really talk about this idea that it's not a money problem only. It's not just poor moms having bad outcomes. If it's almost, if you're a Black or brown woman and you get pregnant in Virginia and you go to the hospital, the rates of you having complications and or death are 2 to 3 times higher than a white or Caucasian pregnant person mother in a lower economic status. And that's just what the numbers are saying. And so that's why we're trying to really elevate this idea of it's all of our business. Prevention is all of our business.
Yes. Mia, that was spot on. If you go to your doctor, Mia, and Stephanie, you can address this too, and something doesn't feel right, and your doctor says you're okay, what do you do while you're in the midst of your pregnancy? Do you elect to get another doctor, or what do you do at this point?
And this is another great question. I think this is that whole demystifying this idea of the power hierarchy with medicine and physicians versus a patient. If you know within yourself that something is going on with your body and it's not right, and the physician's like, oh no, it's just your first pregnancy. I've had that 1,000 times. Oh, it's your first baby. This is normal. I'm like, well, it's not normal for me, and I need a second opinion. As a patient, you can ask for a second opinion. You can find another physician that's going to really meet you where you are and really address you as a full person. Definitely bring a friend along, a trusted someone to come with you when you go to these physician offices, so they can say, wait a minute, you didn't really answer her question. And you can also, I was going to say something else. I just lost a thought. Advocate for yourself. If something doesn't feel right, say something, and then keep your questions coming and ask, well, if this is so normal, why is it that I feel? And then you talk about your symptoms. I feel more nauseous than normal. You're saying within 12 weeks, I should be out of the early morning sickness. It's 15 weeks. I'm still throwing up every hour on the hour. That doesn't feel normal to me. And just ask some additional questions if you're not getting the answers that you feel you need. But I'll let Stephanie was shaking her head, so hopefully I hit some of her points, but I'll let Stephanie take it.
So Stephanie, would you like to add to that?
Yeah, no, I think that Mia was spot on. And I think the one thing I see most of the time is that when people feel like they're not listened to, they get into the system, they shut down, and then they leave, and they're not sharing information with the provider in a way that helps them to understand. And so it ends up being untreated or undiagnosed. And so the reality is, someone can get upset if they want to. When you're in a hospital system and you're advocating for yourself and your baby, you've got to use all those tools. Some of the things that we do, we teach people how to do this through the use of doulas, through prenatal and postpartum visits that we have, so that we can ensure that questions are formed and answered, but then folks feel like they're prepared when they get into these systems where there's a power imbalance and there's a lot of fear related to, advocating for yourself, because it can be very scary to do that.
Well, since I have you, Stephanie, what are the root causes of disparities in Black maternal health, and what are some strategies to address these disparities?
Structural racism, I think, is number one. I don't think that, as we're continuing to try and rebuild these systems, that we need to put communities at the forefront of conversations that are happening about them to ensure that we're addressing disparities and racism in a way that ensures that communities can transform themselves. Until we really put that on the table and we start to address that in that manner, then we can talk around the issue, over and over and over again. it is not by chance that every state is talking about implicit bias, unconscious bias, putting, doulas at the forefront of conversations related to how do we support communities. We're trying to make changes to how care is being delivered because we're stuck in a space right now where we can't make changes in certain areas. So the best thing to do is to put pressure in systems to encourage change. And so that is what I would say is really the root cause of structural racism. That does not mean, and I think that a lot of times as we're talking about this, like people can
Structural.
walk
Yeah.
away and feel like there's nothing that can be done, right?
Mhm.
And that's not true. Because if that were the case, I wouldn't be able to sit here and tell you about all the beautiful, wonderful stories of wonderful, beautiful outcomes that babies and
Yeah.
moms have had as a result of being able to advocate for themselves and going into systems and choosing their providers and all that kind of stuff.
Mhm.
But the best thing that we can do as consumers is one, encourage systems to make change. So then that way we can have better systems of care, because sometimes it's not even about access to care, though in certain parts of the state that is the case. Sometimes it's about access to quality care. And
Wow.
so we really have to work hard on the community side to elevate our voices and hold systems responsible. But also on the other side, as systems, we have to hold ourselves responsible for building something better as well.
Wow. Community based organizations, doulas, midwives, and peer support networks play a crucial role in providing culturally sensitive care, very important, advocacy, education, and resources to Black mothers, addressing gaps in healthcare and promoting positive birth experiences. Now, Stephanie, I know we touched on it. We talked a little bit about making changes, and it's not the end of the world, but we have to work harder as advocating for ourselves, advocating as a family, advocating as a community. But we need to put those lawmakers to work too.
Absolutely.
Shed
You're
some light on that.
So there's been a lot that's been happening even over the last couple of weeks. I mean, there is a bill in front of the governor's office right now talking about unconscious bias, and there's some discussions about language and what we need to do to ensure that we're addressing this within systems. There has been a lot of work to lobby for ensuring that we have access to doulas, not only from a Medicaid side, but from commercial private insurance. I'm sure Jamia will talk about some of the work that has been happening
Yeah.
in home visiting as well. We've really been focused on addressing legislation, access to Medicaid to 12 months
Yeah.
postpartum, contraceptive access for a full 12 months as well. And the list kind of goes on because I think systemically legislation is the way that we need to go in order to ensure that all moms, all families are able to benefit from the access and tools and resources that are necessary for them to have better outcomes. And so those are just some of the things that are happening. We're in a recess, obviously, for the General Assembly. They'll be going back, I think, on the 17th of
Yeah.
April. So
The end of
um,
maternal health
yeah,
week.
but there's been a lot of bills that are currently being signed by the governor's office
Mhm.
and are still up for debate as well.
Yeah, absolutely. Stephanie, thank you so much for that. Now, Mia, tell us more about how your organization, Families Forward, will address maternal health through upstream interventions, and how does home visiting work?
Well, that's a great question. I'm really excited to kind of share the next place. When you think about a family span of a lifetime, you think about the very different interconnected resources that really need to be around to really ensure that a family is thriving, not just surviving in communities. And one of the things that Stephanie talked about was the doulas in the very beginning of that pregnancy, walking the mom, standing beside the mother through pregnancy, birth, postpartum, that area. Then there's like a warm handoff to home visiting. Home visiting is actually a curriculum or a program in which a licensed social worker or a licensed professional, paraprofessional, comes into the home at the request of the family to really partner with that family to achieve the goals of that family.
Mhm.
Now, in the state of Virginia, we do have 8 various home visiting programs around the state. And so Families for Virginia is the state office for 3 of the largest home visiting programs, one being CHIP of Virginia, one being Parents as Teachers, as well as Healthy Families of Virginia. And so what we've learned through the experience of having home visiting across the state is that when families get connected to resources, how, when they need, when it's culturally sensitive, when there's a trust and a relationship built between the home visitor and that family, outcomes are better. Home visiting does make a difference in Virginia. So, just a few stats. So, one of our home visiting programs, Nurse Family Partnership, is not under the state, under the purview of Families for Virginia, but one of the state home visiting models. 5.4% of those babies that participate in Nurse Family Partnership are born preterm, as opposed to 9.9 preterm birth rate in the state of Virginia. So there's increases when families get connected to resources. As far as caregivers reporting substance abuse and or depression, 98.2 of those families were given mental health screenings and then also connected to substance abuse resources through the Healthy Families model. So we're seeing that once we are able to allow folks to get connected to the resources that they need, then outcomes change. And we know that if we're able to stay with a family for as long as the program allows, each model has its own kind of times when families graduate. But if we're able to partner with that family along the continuum of that family, then all of a sudden you see these outcomes are better. So we know that home visiting does work, and we have those stats to kind of to show that.
Mia, thank you so much for that. And here's a friendly reminder for folks who are just joining us tonight. Urban Baby Beginnings and Families Forward are one of the 5 organizations that makes up the Virginia Maternal Quality Care Alliance. Great jobs, lady. Mia and Stephanie. All right. So let's talk about the resources that you provide and how our listeners can get in touch with you. Let's go with you first, Mia.
Sure. So we have an awesome website for Families Forward Virginia, www.familiesforwardva.org. And you can get to all the resources that we have available, and then get connected to something or a resource that might be helpful for you. As a state office, we do not do direct care services. We have over 60 affiliates across the state. So if you're interested in getting more information about connecting with a home visitor near you, then you can scroll to the website, look at the various programs. This is voluntary. So if you want to be part of a home visiting program, you can kind of just search the information and make those connections. And then from there, you'll be directed to an affiliate that's right in your local community.
Thank you so much for that, Mia. And Stephanie, we're going to pretty much end with you. What resources are available for mothers during Black maternal health, or
So
for Black maternal health, that is?
yeah, so for a couple of things to know and remember about Urban Baby Beginnings is that we do have care coordinators that are connecting individuals to resources within the community, such as Mia's home visiting programs and others. And so, if you're looking to figure out, what's best for me, do I need a doula? Do I need a home visitor? Do I need both? Starting with that care coordinator can be a great way to do that. And so you can go to our website at www.urbanbabybeginnings.org and click on the tab that says refer now and refer yourself in. Anyone can refer themselves in. Our target population obviously is pregnant, postpartum, and children under the age of 3. The other thing to keep in mind is that we do have social support groups. We have doulas, and you can access them same way through going through our website. There are also 2 events that are happening, and they're on our Facebook and Instagram pages, which are our community baby showers. They're called Babies in Bloom. And we're working with St. Paul's Baptist Church and Richmond Public Schools in Richmond. And we also have an event that's happening at the Y on Granby in Norfolk. So that's part of our Black Maternal Health Week celebration as well.
Wow, thank you. Any other information you would like to share before we go, Mia and or Stephanie?
I would like to say this is also Child Abuse Prevention Month. So when we think
Yeah.
about mothers and babies, we also want to think about the idea of prevention in that ecosystem that we all exist in. And when we think about
Mhm.
these connections and these community resources, it's one thing to have access. It's also one thing to have access to coordinated places of care. And so I think I just want to empower our listeners to do some research, find out, talk to neighbors, talk to people at church, talk to Big Mama on the block, find out who's got the what, and then let's get connected so that we can really elevate this idea of health and thriving and well-being in our communities, for our communities, with our communities.
Well, that's how we're going to sum it up. Lots of great information shared today. Thank you to our sponsor, Urban Baby Beginnings, and thank you to Mia Crockett. Let's give our viewers and let them know UBB will be back next month with another episode of Maternal Mental Health Week Awareness that's coming up in May. I am Clovia Lawrence, and that's her story, RBS.